Called gender-affirming surgeries for minors have been incredibly controversial, except in maybe the most important place of all, the medical community, where just about every major medical association has supported it, which makes the position of the American Society of Plastic Surgeons so significant. It's an organization which represents 92% of all board-certified plastic surgeons in the U.S., and they are now coming out and saying they won't support it. They told us today, quote, "The American Society of Plastic Surgeons has not endorsed any organization's practice recommendations for the treatment of adolescents with gender dysphoria. ASPS currently understands that there is considerable uncertainty as to the long-term efficacy for the use of chest and genital surgical interventions for the treatment of adolescents with gender dysphoria, and the existing evidence base is viewed as low quality, low certainty. This patient population requires specific considerations." That is a very different position from dozens of the top medical associations in the country, including the American Academy of Pediatrics, the American Medical Association, the Endocrine Society, the American Academy of Child and Adolescent Psychiatry, among many others, who've taken positions that gender-affirming care isn't just safe, but also medically necessary. Major American medical institutions have also either ignored or disputed findings of what is now known as the CAS review, a 4-year review ordered by England's National Health Service and released earlier this year, finding that when it comes to medical intervention for kids experiencing gender identity issues, quote, "There is not a reliable evidence base upon which to make clinical decisions or for children and their families to make informed choices. The strengths and weaknesses of the evidence based on the care of children and young people are often misrepresented and overstated, both in scientific publications and social debate." And they also said for the majority of young people, a medical pathway may not be the best way to manage their gender-related distress. For those young people for whom a medical pathway is clinically indicated, it's not enough to provide this without also addressing psychological issues. The report led to restrictions on youth gender care in Britain, but stirred a lot of controversy in the U.S. So for an organization like the American Society of Plastic Surgeons to say that the evidence for gender-affirming surgeries, which are not reversible and involve top surgery to remove or enhance breasts, bottom surgery on genital or reproductive organs, even surgery on the face, to say the existing evidence behind it is low quality and the long-term outcomes uncertain is a break from the consensus and will certainly lead to blowback. Joining me now is Dr. Sheila Nazarian. She's a plastic surgeon and a member of the American Society of Plastic Surgeons. Doctor, thank you so much for joining us. Appreciate it. So I understand that you are not here speaking on behalf of the organization, but what is your takeaway from the American Society of American Plastic Surgeons statement?
Well, honestly, I've been following everything that's happening in Europe, and it's not just the UK, Dan. It's Norway, Finland, Sweden, Germany, Denmark. They have all began to back off. And honestly, I think one by one, we are slowly becoming the outlier here in the United States. And I just have to say, I'm so grateful to the American Society of Plastic Surgeons that they have had the courage to stand up and say that the quality of evidence is poor and that they don't have confidence that the benefits outweigh the harm.
Now, you know there's going to be a lot of blowback on this, not just from advocates, but also from other medical associations who are going to say, look, we've looked at this and we don't know why these guys aren't joining us.
I would say that from a personal and professional experience, this issue has become so politicized that a lot of people are very hesitant to speak up. They're afraid of getting canceled, and that's not what medicine should be. And I think that that's such an important point, Dan. Every other surgery, every other medical treatment, we're allowed to talk about, we're allowed to engage in debate, we're allowed to research, we're allowed to question in order to get best outcomes. And we don't ignore our colleagues internationally and their data that is more long-term than ours in almost any other aspect of medicine or surgery. And I really want to step away from the politicization that is happening in America in medicine, which can be very dangerous, and say that In Europe, it's been very much a bipartisan effort. Very left-leaning governments have come to the same conclusion that they need to back off of doing these surgeries that haven't been shown to have benefits that outweigh harm.
Thanks for watching. Go to joinnn.com to find NewsNation on your screen. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.